Milk allergies in children. A milk allergy occurs when a person's immune system mistakenly identifies the proteins found in cow's milk, or other animal milk, as harmful invaders. This triggers an immune response that leads to various symptoms. Milk allergies are most common in infants and young children. About 2.5% of children under the age of 3 are allergic to milk. However, most children tend to outgrow their milk allergy as they get older. Symptoms of a milk allergy typically manifest immediately or within 2 hours of consuming milk or milk-containing products. These symptoms may include skin reactions such as hives or eczema, gastrointestinal symptoms like nausea, vomiting, or diarrhea, respiratory issues including coughing, wheezing, or difficulty breathing, anaphylaxis, which is a severe, potentially life-threatening allergic reaction that can cause swelling of the throat, difficulty breathing, a sudden drop in blood pressure, and loss of consciousness. Milk allergy. Immune system involvement. In a milk allergy, the body's immune system reacts to the proteins found in milk as harmful invaders. This triggers the production of immunoglobulin E, IgE, antibodies specifically targeting milk proteins. Response. When the person with a milk allergy consumes milk or milk products, the immune system recognizes these proteins as allergens and launches an immune response. This response includes the release of histamine and other chemicals, leading to allergic symptoms. Symptoms. Allergic reactions to milk can involve various systems in the body, including the skin, hives, eczema, respiratory system, wheezing, difficulty breathing, and digestive system, nausea, vomiting, diarrhea. Lactose intolerance. Digestive system involvement. Lactose intolerance, on the other hand, is primarily a digestive issue. It occurs due to a deficiency of the enzyme lactase, which is responsible for breaking down lactose, the sugar found in milk and dairy products. Response. Without enough lactase enzyme, lactose remains undigested in the digestive system. This leads to various gastrointestinal symptoms as the undigested lactose ferments in the gut, causing discomfort. Symptoms. Common symptoms of lactose intolerance include nausea, cramps, gas, bloating, and diarrhea. These symptoms typically occur after consuming milk or dairy products. The key difference between a milk allergy and lactose intolerance lies in the underlying mechanisms and symptoms. A milk allergy involves an immune system response to milk proteins, leading to allergic reactions affecting various body systems. In contrast, lactose intolerance results from the inability to digest lactose due to a deficiency of the enzyme lactase, causing gastrointestinal symptoms. Testing and diagnosis of milk allergy. Skin test. Procedure. Allergy skin testing involves introducing a small amount of the suspected allergen, in this case, milk protein, to the skin, usually on the forearm, using a gentle prick. Response. If the child is allergic to milk, the immune system may react to the milk protein by causing the development of a hive-like bump or rash at the site of the skin prick. Indication. The appearance of a hive-like bump during the skin test may indicate a positive reaction to milk protein, suggesting a milk allergy. Blood test. Allergen-specific IgE blood test. Procedure. A small amount of the child's blood is drawn and tested for the presence of immunoglobulin E, IgE, antibodies specific to milk protein. Response. if the child has produced IgE antibodies in response to exposure to milk protein, the blood test may show elevated levels of milk-specific IgE antibodies. Indication: elevated levels of milk-specific IgE antibodies in the blood may indicate a milk allergy. Food challenge test. Procedure: this test involves giving the child small, increasing amounts of milk protein orally in a controlled, highly supervised clinical setting. Response: the child's reaction to each dose of milk protein is closely monitored for any signs or symptoms of an allergic reaction. Indication: if the child experiences symptoms such as hives, wheezing, or gastrointestinal distress during the food challenge, it indicates a positive reaction to milk protein, confirming the diagnosis of a milk allergy. The diagnosis of milk allergy typically involves a combination of taking a detailed medical history, conducting allergy skin testing, performing blood tests for milk-specific IgE antibodies, and, in some cases, conducting a food challenge test. These tests help clinicians accurately diagnose milk allergy and determine the appropriate management and treatment plan for the child. Complications. Children who are allergic to milk are more likely to develop certain other health problems, including nutritional deficiencies. Cause: due to the necessity of avoiding milk and milk products, children with milk allergies may have dietary restrictions that can lead to nutritional deficiencies. Consequences: restricted intake of milk and dairy products may result in inadequate intake of essential nutrients such as calcium, vitamin D, protein, and certain vitamins and minerals. Effects: this can lead to slowed growth and development in children, as well as deficiencies in vital nutrients necessary for overall health. Reduced quality of life. Cause: milk and dairy products are common ingredients in many foods, including unexpected items like salad dressings or processed meats such as hot dogs. Consequences: for children with milk allergies and their caregivers, navigating food choices can become challenging and stressful. The need to constantly read labels and avoid potential sources of milk protein may lead to increased anxiety and frustration. Impact: this can have a negative impact on the child's overall quality of life, as well as on the family's meal planning and social activities involving food. Prevention. There's no sure way to prevent a food allergy, but you can prevent reactions by avoiding the food that causes them. Avoidance of milk and milk products. Key strategy: the primary way to prevent allergic reactions in individuals with milk allergy is to avoid consuming milk and milk-containing products. Implementation: this involves carefully reading food labels to identify milk and its derivatives, such as casein, which may be present in unexpected foods like canned tuna, sausage, or non-dairy products. Vigilance: even foods labeled as milk-free or non-dairy may contain traces of milk proteins, so it's essential to scrutinize labels and, if unsure, contact the manufacturer for clarification. Awareness and communication. Reading labels: milk can be an ingredient in processed foods, including baked goods and processed meats. Therefore, it's crucial to thoroughly read labels to identify potential sources of milk. Inquiring in restaurants. When dining out, inquire about how foods are prepared to ensure they do not contain milk or milk derivatives. For example, ask whether steak has been cooked with melted butter or if seafood has been dipped in milk before cooking. Emergency preparedness. Carrying epinephrine. Individuals at risk of severe allergic reactions, such as anaphylaxis, should discuss with their healthcare provider about carrying and using emergency epinephrine, adrenaline. Use of epinephrine, in the event of an allergic reaction, prompt administration of epinephrine can help alleviate severe symptoms and potentially save lives. Milk alternatives for infants. Breastfeeding. Recommended source of nutrition. Breastfeeding is highly recommended as the best source of nutrition for infants, including those with milk allergies. Benefits. Breast milk provides essential nutrients and antibodies that can help support the infant's immune system and overall health. Duration. Breastfeeding for as long as possible is encouraged, especially for infants at high risk of developing milk allergy. Hypoallergenic formulas. Production process. Hypoallergenic formulas are made by breaking down, hydrolyzing, milk proteins, such as casein or whey, using enzymes. Further processing may involve heat and filtering. Types. These formulas can be classified as partially or extensively hydrolyzed, or as elemental formulas. Some may also contain amino acids. Least likely to cause reactions. Amino acid-based formulas are considered the least likely to cause allergic reactions in infants with milk allergies. Soy-based formulas. Source: soy-based formulas are made from soy protein instead of milk. They are fortified to provide complete nutrition for infants. Concerns. However, it's important to note that some children with milk allergies may also develop allergies to soy. Therefore, soy formulas may not be suitable for all infants with milk allergies. Dietary adjustments for breastfeeding mothers. Exclusion of milk products. If a breastfeeding mother's infant is allergic to milk, cow's milk proteins passed through breast milk may trigger an allergic reaction in the infant. Dietary changes. The mother may need to exclude all milk-containing products from her diet to prevent allergic reactions in the infant. Consultation. It's essential for breastfeeding mothers to consult with their healthcare providers if they suspect their infant has a milk allergy and develops allergic symptoms after breastfeeding. Nutritional considerations. Supplementation. Infants on a milk-free diet may require supplementation to replace nutrients found in milk, such as calcium, vitamin D, and riboflavin. Guidance. Healthcare providers or dietitians can provide guidance on planning nutritionally balanced meals and selecting appropriate supplements for infants with milk allergies.